too often we only have 10 minutes per patient or 5 minutes just to talk to them, and that's not good, that's not medicine.
Hi, my name is Vlad Votășescu, and this interview is part of the Person Behind Academic Success series. Our guest is an incredibly important figure in the field of plastic surgery and the doctor who realized the first full face transplant. Welcome, Professor Joan Pere-Barret.
Thank you, it's a pleasure to be here.
I want to start by saying it is a great honor to interview such an accomplished and innovative doctor as yourself. On behalf of all the teams involved, MEDSCHOOL, Medics, and Anatomika, I thank you for taking your time to sit down and talk to us. We are incredibly grateful.
Thanks.
The main audience for this interview is represented by medical students, and they want to know what it takes to reach such academic and professional heights. So let's start from the beginning. You studied medicine at University of Barcelona, where you also did your residency training. As many people are aware, this is one of the best academic centers in the world. What was the motivation behind you studying medicine? When was your passion for the subject ignited?
Well, it started at a very young age. I remember that for the beginning of my life, I wanted to be a cabinet maker, like my father. I was going to his artwork just to use wood and make small things with him. But then I remember that he couldn't have much of the opportunity of going to school and everything, but he was reading a lot. He was always buying magazines. He was always, reading books. And then I started just to go through things that he was reading, like also advancements in medicine or things like that. And all of a sudden, I probably was 8 or 9 years old, and then wow. I decided something grew inside me that was telling me that I was a doctor. Not that I really wanted to be a doctor, that I had this necessity of becoming, of studying medicine. And all of a sudden, I remember doing one lunch. My sister, she was preparing to go into law school. And then they asked me, do you still want to be a cabinet maker like your father? And I was very shy. I said, no, I want to be a doctor.
Wow.
So, and it was fascinating me, life and how things could be changed or treat people or, learning the meaning of life and how, biology, cells, everything.
Okay, so you were curious to find out more about the human body, but you're also eager to help other people.
Mm-hmm. Yeah, this is medicine. I mean, at that time there was biomedicine or bioengineering or all sorts of bios didn't exist. So it was either biology or medicine or physics or chemistry. It was very, very truncal, learning. So I really was very curious about life, about medicine, and also, but medicine, it was going to your question. Medicine is about helping people, about treating people. So nowadays, if you want to study a lot, the basis of disease, so help finding cures or something, you better probably off doing biomedicine. But if you really want to treat patients or people, help people, prevent disease, maintain health in the society, is medicine that you really have to study. But we have to, as medical students and future doctors, and the doctors have to remember that we help people. This is what we are here.
As you said before the interview started, you and a lot of people actually have this anxiety when it comes to talking to people, to a lot of people. How did you manage that in your career as a doctor? How did you manage talking to people and interacting with them?
Just doing it. I mean, you have to overcome your difficulties in life and then try and fail. Like today, one of the AI, experts said, try and fail until you succeed. And in that, you get very nervous the first time, probably the second time when you give a conference, and the first time you have to make a full history and full physical examination in a patient when you are a third year student or something, but you have to do it because this is what it's all about, to interact with people. And I was also saying earlier, it's very important that we listen to other people, that will listen to the patient, because they are trying to tell you something always. And then all the signals and all the data is there, whatever is want to tell the patient to you.
So listening is very important. Moving forward, after finishing your specialty training, you continue to expand your knowledge by traveling to different academic centers in the US, in the UK, and the Netherlands. Would you say this time was crucial for your development as a doctor?
I do believe it was. I mean, I decided to study to specialize in plastic surgery because it was giving me what I really liked. It was being able to operate on different parts of the body, knowing very well the anatomy, the researching about wound healing and hypermetabolism in burns and so, which was something that really liked it a lot. And also I choose to stay in Barcelona because I had that big burn center, which really interested me. Many of the things just happened because I was always curious. I was wanting to know more or to expand my knowledge. And then because you are so determined to reach your goals and to go there, then people start asking you to do things, or you become, more and more, maybe well seen or well known around the world. So to know that people are done differently in different places around the world, and that is not the same. And also to take the good things with you, and also to learn that you're doing very good things back home. So that's very important, because we tend to think that everything is bad home and the rest of that is good. When I was a junior or a resident, they were telling me that some things cannot be done in Spain because it was done by, British people or Americans, and they were like Superman. I mean, like astronauts that, they were born in that way, and then you will never be able to do that. But I remember that the things they were telling me, no, we cannot do that. I was doing them after a year in the US. So it means that it is you, is that empowers you. So my message to junior and people and medical students is that to believe in you, and also go and take out the more 100 or 120% of what is inside you, because the limit is only in you. It's not around. I mean, don't take a no for an answer. Never.
Yes. So your driving factor, your driving motivation was that you were told you cannot do this in Barcelona, and you just did that. You went abroad, you gathered the experience, the knowledge, and applied it in your hometown.
Yeah, when I went back after almost 10 years back as a head of the department, and I started doing those things at home, I remember that the residents were telling other people that the things that they were seeing, they thought they were impossible, or that they were just things that they would never see, and then we were doing that, and now they're doing them. I mean, fortunately enough, I've trained very good now number of junior doctors, and that some of them are in other hospitals, some of them stay in my department, and now I almost redundant there. I mean, they operate even more than me, and they do great things, even because what makes, I believe, when you're in I'm not the boss, in
The top of the food chain?
Yeah. What makes you very good is not yourself, is all the people that you train and all the people that are around you, the people that you really take all together, and that makes them, even if they are even better than you, that makes even myself better.
Yeah. So your success is measured by how well you train the people around you,
Yes.
how well you grew them. That's actually inspiring. That's inspiring.
Yeah, because I remember first time when we decided just go ahead do a face transplant. It was my drive. It was really my determination that we had to do it at Barcelona. But then I remember that then you tell the people, and people all of a sudden follow you. I'm not a leader, but probably I am, because I remember that that night, they were so happy. They were just there. They was fighting around all the elements, and then they were backing me, and I was feeling that I was taking them even for a very, a party rather than an operation that we didn't know how that was going to end. So.
The full face transplant was truly an innovation. What I'm curious, and probably most of our listeners are curious about, how did the idea come? Where did the idea come from to do a full face transplant?
Well, we had been talking about doing face transplants as early as the beginning of the year 2000. When I was in the UK with Peter Zubulski, Venkat Ramakrishnan, they are still there at St Andrews Centre in the UK. And we had that patient that couldn't be operated on at that time in 2003. And then when we came back to Barcelona, we started making all the arrangements and talking to liver transplant surgeons at the hospital, to the bowel transplant surgeons who helped them a lot, infectious diseases experts to build the protocol. They were talking about how this had to be developed. But then in 2007, the patient came asking for help, so a patient without a face. And then we had been following the first clinical experience with other friends that have done, so Len Thierry, Maria Semyonov, Wells, were doing, and Jean-Paul Menigo, with the Duvernat, all that. They were doing parts of the face. And then after seeing our patient that had different, problems, and then only doing that part of the face, it was going to be a very strange appearance with the scars all over the place. And then the knowing that if that failed, that would be a big problem, that only a new retransplant would save his life, or that he could die. Then we thought, well, we have to do the whole thing, because that is what makes sense. I mean, doing like an organ, all the face, just take it out, just put in a new one, because if this fails, he may die. So we have to give the patient the best functional outcome possible. This is why we decided that the answer was just to remove the whole face.
So this was out of necessity. And you said that you assessed the risk of the procedure. How did you do that? So you said that the risk of doing just a part of the face was as high as doing the whole face. So it just made more sense to do so. My question is, what advice do you have for future doctors on risk management when it comes to difficult cases?
Well, it's very important to understand whether the benefit that what you're doing is over the risk of the procedure. So that to assess, so again, to have enough time to know your patient, know what they do, know what are their expectations, know that whether what the important things in life are for them, and then explain them very well what are the risks and the possible outcomes of every different scenario, not only for surgery, for any sort of chemotherapy, whatever, how is going to be the outcome, how is going to be life during the treatment, and so they can make a decision with you, and then also understand whether that percentage of improvement is on top of the risk. So if the risk is over 50% of, for instance, death, probably the benefit has to be 100%. Otherwise, there's no risk-benefit scenario here. In transplant surgery, a 50% death ratio is accepted. Because,
it's accepted.
It is. Because when we had that problem with the second phase transplants, that the death probably ratio would be as high as 50%, they say, well, that's acceptable according to the transplant coordinators. But always you need to know very well who you're dealing with, not only the patient, but their expectations, their life, relatives, what is important for them, and then knowing that, for instance, if you give a very potent chemotherapy that may give them only 1 year of life expectancy with a very bad, prognosis, then knowing whether that's better off than leaving them with 2-3 months or without medications, but with complete no side effects, and then enjoying life with the relatives. So that's how you have to manage that. I'm sure the artificial intelligence is going to help in some managing decisions because they will gather all the data that we know, not all that we will do a reading, so that's going to help us. But I would say that, again, we are doctors, so we have to listen to the patient and talking to them and having enough time. When you have to have an hour with them talking, that's it. So too often we only have 10 minutes per patient or 5 minutes just to talk to them, and that's not good. That's not medicine.
That's not medicine. So this is actually coming back to what we said in the beginning, to listening, patience, and also letting the patient make their own decisions. Only be there as a participant as in participatory medicine.
We have to lead them. We are the expert. They want to ask for our advice. They were going to ask, what would you do it? Yeah, the answer is always, I'm not you, but sometimes when we know very well the patient, you know what they really, you can help them, also guide in the decisions. And we shouldn't be afraid of having empowered patients. More and more now, even now with AI and everything, they want to get a lot of information from the internet, from other sources. They will come with a lot of information. Some of them, they probably even know the answer for the problem, but they want your advice, whether you are agree with that or that. And we shouldn't be aware of that. I mean, sometimes we have to help them to understand that some of the information is wrong that they got, but some of it is right. And even in my experience, patients that have got a little bit of information are easier to help than others that don't. So I think that empowering the patient as the center of your decision process is very important.
You also mentioned artificial intelligence. One of my questions was going to be, do you think AI will have the impact on the field of plastic surgery or in medicine in general?
In medicine in general, the impact has been huge, I believe. Now I'm getting radiology reports written by AI.
Wow.
And they countersigned by the radiologist, saying that I agree or something, and then put a countersigned by the radiologist, but the diagnosis has been done by AI. So I think it's there. We have to remember that AI works with data, and the data is produced at the moment by human beings. So we can produce data, scientists and everything, produce, with the clinical investigation, whichever, and then AI works with that and then gives you the best solution or according to your answers. But that's going to make a huge difference in medicine, in life, in society. I think we are at the edge of probably a real revolution or evolution of human beings on society and probably evolution of humanity, because probably AI is going to teach us also something in the future and help us to take care of the planet and of societies and other human beings.
So you think AI will not only have a great impact on medicine, but it will have a global impact on all industries?
Yeah, absolutely. Probably if you ask AI about, what happened in different societies that were extinct, or that now, because there are very books about that and everything, and then compares with all that data that you can give them to what we're doing now, probably the answer I will say that probably in 100 years or 50 years, the human beings will be extinct if we don't change. Why? Because that has happened before. No, in the Easter Island, in the Nazca societies, in Mayas and other places, because they were exhausting all the capacities of the environment, and then they had to leave or to die. So I'm sure that would be the answer. So that's going to help us also to change things.
To help prevent that, hopefully. Now, for the final part of the interview, I want to ask you, if you could go back in time and give any advice to yourself when you were a student, what would that be?
Well, my advice would be to myself, yes, to even join, even in a deeper perspective, with department of biochemistry, biomedicine, to investigate even more the basics of biology and medicine. That's good, but very few issues. Probably my advice to my younger one would be, marry your wife earlier than you did. Even children before you did, because you were wasting your time. But other than that, many other things probably will be the same.
So your opinion is that we should start enjoying life earlier, not later.
Yeah.
Okay. Now for the final part, this should be fun. I want to know what is the first word that pops into your mind when you hear a word from my list. So for example, I say food, you say pie if that is the first word that comes into mind. Shall we start?
Yeah, sure.
Future.
To come. Well, what future? Well, yes, let's start again. Future. Everything.
Cancer.
Cure.
Technology.
Friend.
Transplants.
Failure.
Aging.
Opportunity.
Medicine.
Oof, that coming too many. Medicine, passion.
Passion. Okay. That would be the end of it. Thank you so much. Thank you
right.
for your time very much.